Hi guys, welcome. Welcome guys. What's up? Oh, dang it, I'm so sorry. I accidentally closed down the chat. Let me open that up. There we go. There we go. Welcome guys. How's it going? My name's Zach. I'm a third year anesthesiology resident. Um, how's it going? I'm out in LA this month doing some trauma anesthesia. Last night we had another pew pew incident. This one was crazy. Let's say I was in a few honor societies. Um, Phi Kappa Phi. I was in I think it was Phi Kappa Phi. I was in another engineering one, and then my school wasn't eligible to have an AOA for medical school, but I graduated with honors, so yeah, not technically AOA, but in the criteria or category for AOA. How about you, Angie? Were you in any honor societies? Sorry, guys. So last night we had this pew pew trauma activation show up. He got pew pewed in the chest. He got pew pewed in the stomach. It's pretty common places to get pew pewed. Bring him back to the operating room. Man, we transfuse a lot of blood. We do a central line on him, a giant IV in the neck, an arterial line, and he ended up surviving. The crazy thing was he needed a lot of epinephrine, and I was like, I think something's wrong with his heart, guys. And the surgeons were like, no, it's fine. I'm like, are you sure? Because this is a lot of epinephrine. And then eventually they did what's called like a pericardial window, and they found a whole bunch of blood around his heart. And the guy had actually been shot on the right side of his heart. Yeah. All right. I'm back. Yeah, definitely cardiovascular surgeon. Yeah. So it was a crazy night. He survived though, which was amazing. I dropped him off in the ICU while he was on 2 vasopressors called norepinephrine and epinephrine, and they were pretty high amounts. But once the anesthesia was wearing off, I don't think he needed very much. Anyway, it was a fun night. That was a 12-hour surgery. Big Mama said, I saw you last night, you think. Well, I was at the hospital all night until 7 a.m. I do not mean to be mean. Doctors now do not look for the cure. We do. I don't know where you get that, Big Mama. Almost every doctor I know is looking for the cure because that's why we got into this business. If we wanted to make money, doctors are smart enough. They could be engineers, software developers. Oh, shoot. That stinks. Software developers, investment bankers, all these things. And we could go make good money doing that. My fiance said I'm wife yellow too. Just had my microdiscectomy surgery. I'm feeling super nauseous and dizzy. Took gravel this morning. So, JMac, it is very common to be nauseous and dizzy after surgery. That doesn't necessarily mean anything's wrong. It doesn't mean something's not wrong, right? So, like, I have to say CYA statements. But in general, nausea is very common. Do you stay the whole time in surgery? Sparkles, yeah. So, the entire time we went back to surgery around 8 p.m., and I did not leave the operating room until 7:15 a.m. when I transported him to the ICU and dropped him off. So I just recently started drinking coffee about a year and a half ago. I lived 30 years of my life without drinking it. Hi, DJ Jammin, welcome. Um, but yeah, now I'm kind of doing like the lattes and stuff. Thanks, Big Mama. Yeah, so now that's not necessarily true. If the surgery would have lasted another hour, the day team for the anesthesiologist would have came in and probably relieved me. Um, so Panda Bear says this isn't true. Doctors are doctors of medicine. I'm on 26 pills a day and I have multiple things going on. Panda Bear, let me just talk about this. I and most of my colleagues do not get paid more or less money depending on how much we do or do not prescribe you. Most physicians do not get paid to prescribe certain medications. As a matter of a fact, it's illegal. There's called anti-kickback laws. And if I were to prescribe you a medication and get paid for that in some way, or if I were to refer you to a certain physical therapist that then gives me a small kickback of, let's say, $25 as a friendly fee, that is illegal. That is absolutely illegal. I could lose my medical license. So the fact that you're on 27 medications tells me that you have something going on that there's not a cure for, unfortunately. I wish we had cures for everything. I wish I could fix everything that was going on with people. Our bodies are really good at fixing a lot of things, but not everything. And there's only an extent, right? Our bodies can only fix everything to an extent. And go to the breakfast area at hotel and get you a fork. Yeah. I have a few other plastic forks. I'm really bummed that when I went to eat my food, mine broke, but I'll get it. So, again, if someone's prescribing you 26 medications, it's not because we're doctors of medicine and that's what we do when we're bought out by Big Pharma. It's probably because you need them. And if you don't need them, well, there is a thing called polypharmacy where sometimes people see different physicians, we don't communicate well, and you get prescribed a lot of medicines that maybe you shouldn't. And that's why you should have a primary care doctor that sees everything. SVT, supraventricular tachycardia, is a very serious heart arrhythmia. It's basically where your heart is beating so fast and it won't stop. And if it keeps going, it can become symptomatic, cause people to be lightheaded, dizzy, pass out. It can cause a lot of strain and stress on your heart, and it needs to be addressed, oftentimes immediately. Sorry, guys, about 2 weeks ago, I had the flu, and I'm getting over it. I might cough and sneeze and stuff a lot. How old were you when you finished med school? I think I was 30 years old when I finished. I was 30 or 31, something like that. 30, maybe 29. I don't know. I have degenerative back disease. I've had it for 29 years. I try things naturally help. Big Mama, let's talk about back pain. I have an Amazon storefront link for all of some over-the-counter recommendations that I always talk about. And for those of you, does anyone else in the chat have lower back pain? Because I'm sure you do. What's up, Chris? Welcome, welcome. Some of the things I love to talk about, people probably get sick of hearing me say this, but a TENS unit, lidocaine patch, menthol patch, Tylenol and ibuprofen are great. There's a few other topicals, Voltaren gels, Voltaren cream. It's a topical. Yeah, everyone's got low back pain. And almost everyone has degenerative disc disease. It's kind of a natural function of aging. So those are a bunch of things that you can check out. You can go to my Amazon storefront and see some of the brands I recommend. But other things to try once the over-the-counter stuff hasn't stopped working is see a chronic pain physician, epidural steroid injection, spinal nerve stimulators, things like that. Oh, someone had a comment pinned, and it went away before I could see it. Was it a bad comment? Someone asked about chiropractors as well. So if you have low back pain, chiropractors, they have a limited but effective role. Oh my goodness, no, I did not hear about that. Maybe I should do a little video about it. Chiropractors can help with your low back pain. What chiropractors can't do is they can't fix your scoliosis and your alignment, and they can't take your hips that are uneven, and they can't make one leg grow bigger than the other. Those are things that are impossible. But they can fix some acute back pain with an adjustment. But there's also risk, by the way. Thanks, Chris. Hey, April. Thanks for the goat. I have Addison's, and for the past 5 days, I haven't had any strength in my legs. That's worth going to the doctor and being evaluated for. You may need to adjust your Addison's medications. Maybe your body's requiring a higher dose of steroids, things like that. And there are also other reasons to have weakness in your legs. Some are usually associated with viral illnesses or more rarely nerve diseases. So that's something definitely to get checked out. I just had my second spinal cord stimulator implanted, lifesaver. So Deborah Bernack, and stating that she did a spinal cord stimulator probably by a chronic pain anesthesiologist or a neurosurgeon. Those are usually the people who do it. And I think they work great. Deborah Ann also has one, and Deborah Bernack. Becca, Nick, and Chaos Gremlins, an electrical engineer and veteran. Love it, guys. Good evening, Bales. I'm doing well, thank you. Hip issues, thinking more femoral nerve. Maya, so there are a lot of people have hip issues. A lot of people have lower back pain, and sometimes they get confused. Sometimes it's hard to determine what's causing what, the low back pain, the hip pain, etc. So you really need to see a physician and get a thorough physical examination by a chronic pain physician, a sports physician, someone like that, so that they can kind of determine, is it sciatica? Is it an SI joint issue? Is it actually a low back pain issue? You need to do those things. And there's some other techniques too when you go to establish care with these chronic pain physicians. You can get like medial branch blocks, numbing blocks. You can get the epidural steroid injections I mentioned, but you can also get what's called radio frequency ablations, RFAs, and those can last for a very long time. What was the hardest body system for you to study in school? Neurology for me, the brain. I don't understand the brain. Buick said PT manipulated my back and shouldn't have. And I can say that's a risk. That's a risk with physical therapy. That's a risk with chiropractors as well, right? If you go into an overzealous chiropractor and maybe you didn't tell them all your medical history because you didn't think about it, they can do an adjustment that could hurt you. And a physical therapist too, if they're not aware of everything that's going on, they could do an exercise that might hurt you. Do you think spinal blocks or epidurals for childbirth can cause back problems? Amanda, it's possible, but I will say the research studies they've done demonstrate that people who get epidurals and spinals versus people who don't, that both have a vaginal delivery, have the same rates of back pain. So that tells me that it's probably not the epidural. It's probably because what is common? So what do both of those groups have in common? They're both putting their legs up in stirrups. They both have people pulling back on their legs, sometimes pushing down on their stomach, and they're oftentimes doing this for literal hours. So it's probably the positioning and the pushing of labor that's causing the low back pain. But that's not to say that, yeah, sometimes an epidural or a spinal might cause it. It's just not as common. Yeah, it's always the child's fault, by the way. I'm getting that radio frequency ablation for my facet joint arthropathy. Hey, thanks, Chris. I hope that works out for you. So my residency is 4 years long. I'm in my third out of 4. I got about 15 months left, but who's counting? And then Fellowship is 1 additional year. So what we say, that's 5 years of postgraduate medical education. Can a breathing test give a false positive for COPD? I will say that a breathing test, or pretty much any test, can always give a false positive, though those PFTs, you're probably talking about a pulmonary function test, they're pretty good. They're not, I haven't heard of many false positives, but I'm not a pulmonologist either. Trigeminal neuralgia, carbamazepine is a great prescription medication, and an additional thing you can try is maybe acupuncture. Limited effects, but potentially it could help. And then, in rare instances, in the right person, you can do a surgery for that, but pretty rare. How serious is a bundle branch blockage? So, a bundle, for one, that's something that a cardiologist should be following, okay? That tells me, a bundle branch blockage tells me that your heart has an injury. It might be a recent injury, but more than likely, it's an injury that happened weeks, months, or even years ago, like a little mini heart attack or something, and your heart's not conducting the way it should. So, if you don't take care of your heart and you don't take care of yourself, that can get worse. But also, you should follow up with a cardiologist because there are some bundle branch blocks that need to be treated with medications. I'm on Zepbound and it's helping my health issues, kidney inflammation, etc. Yeah, these medications like Zepbound, tirzepatide, these GLP-1s, they're amazing. They're saving lives. They're fixing, um, they're preventing heart attacks, etc. I have not heard of Flexid. All right, guys, you get to come with me on a mini adventure. I'm going to step away real quick. I'm going live on a few other platforms, Facebook and YouTube. They're not as good as TikTok, though. If you guys want to see, for those of you watching on Facebook and YouTube, you could follow me on TikTok because I'm on live on my phone on TikTok, and I'm going to take a little walk. I have to, so I'm living in a hotel this month, and I don't know if you guys have ever lived in a hotel. It's not super fun, but it's not too bad. Anyway, they have like coin laundry machines, so I have to do my laundry. So we're gonna go walk down to the laundry aisle and flip my coat over while you answering those questions. What I said about Zepbound is that bias. I'm an anesthesiologist, so I'd love to sedate people, but like in general, it's safe. It'll make your experience pleasurable. Why not? Welcome. All right, I'm back. For those of you on Facebook and YouTube that did not come with me, you missed a riveting conversation about anxiety and depression. Kidney problems since 1978. My insurance won't pay for sedation. Yeah, that's another problem, actually, is that sometimes insurance won't pay for sedation for procedures. There might be a way that your physician can get a prior auth if you have severe anxiety or something, or PTSD. Are you asking what type of sedation would be best? I have to defer to the physician. A benzodiazepine like Versed or midazolam and a little bit of an opioid is always a good thought. So fibromyalgia. I would recommend Versed. Fibromyalgia is a tough disease. It's what we call a diagnosis of exclusion. That means you have to go up a very thorough workup and make sure nothing else is wrong. And if nothing else is wrong, basically they call it fibromyalgia. Duloxetine, SSRIs, SNRIs, trigger point injections, basic pain medications like Tylenol and ibuprofen, and avoiding certain triggering events. Best way to treat fibromyalgia. But I'm not a fibromyalgia doctor. I'm not a specialist. So there may be new updated science and treatment guidelines I'm not aware of. I got prescribed Buspirone 7.5, scared to take. Buspirone's pretty good. Pretty well tolerated. Yeah. When you are on medications like SSRIs and SNRIs, and even gabapentin and certain things for a long period of time, your body does become kind of dependent on it. And so I never recommend, for one, stopping your medications without talking to your doctor. And for two, usually when you talk to your doctor and you want to stop it, developing a tapering plan. Ativan is sedation. So Ativan for an MRI is considered sedation, and it could work well. Well, anesthesia should be covered for a bone marrow aspiration. Gift for an answer. Oh, that's so kind of you. It depends. If most of the time, yes, I have done bone marrow aspirations with some sedation and local anesthetic. If you're under the age of 18, if you're a pediatric patient, it will almost always be covered for sure. Okay. Ways to help get it covered is if you have pre-existing conditions like anxiety, PTSD, etc., things that would mean that getting a procedure without sedation or something could be very traumatizing for you. You might have to get a prior auth for that, though. My mom has severe HBP and never had, thank you, what the RX are. I never had what they RX her, but she's taken Ativan for anxiety. Ativan is one that I do not recommend taking long-term for anxiety. That is for something if you have like acute, or like if you have like an anxiety flare-up, like a panic attack or something. Like, yeah, there's better medications. Never quit an antidepressant cold turkey. The brain's out. Yeah, that's true, Jimmers. I agree with Jimmers. Can you mix antidepressants and Advil? Yes, you can take Advil while you're taking an antidepressant. Aloha, Leilani. Are you in Hawaii? Can you repeat what you said about fibro? So, I'm curious, how common is fibro in the chat? How many people have it? My general opinion about Klonopin is it's for the right people, the right patient. It's an effective medication. So fibromyalgia is a diagnosis of exclusion, meaning you have a lot of pain in diffuse areas. There's no other diagnosable cause for it. And that's a simplistic view, but in general, for the layman, that's essentially what fibromyalgia is: diffuse pain in various areas that move and go, or stay, or persistent. And some of the better treatments for it are one of changing your environment or any triggering factors that may be impacting your fibromyalgia. because we got blocked for talking about alcohol, tobacco, or drugs. Okay, cool. God, what was I saying? Fibromyalgia. So treatments like SSRIs, SNRIs, changing your environment and any triggering factors, even your diet, etc. And then physical pain medications like Tylenol and ibuprofen. Did I say duloxetine? Duloxetine is pretty common, pretty good one. And even alternative medicines like acupuncture, chiropractic care, things like that can help. But also a big thing associated with fibromyalgia is having a history of trauma, if it's physical trauma, if it's sexual trauma, mental trauma, etc. So, no, fibromyalgia is a real thing. So, treating some of those underlying conditions, like the PTSD, the anxiety, and stuff, can also help with the fibromyalgia because your brain creates pain, right? So when you're experiencing mental anxiety and stress, it can manifest as very real and very physical pain. So fibromyalgia has a strong connection with that. And I think by treating your mental pain, your anxiety, your trauma, you're going to treat your physical pain too. All right. It's your body is a whole system. Everything kind of works together. Goodness. How do you stop Prestige with the severe side effects, brain synapse, vision issues? What is Prestige? Let me look that one up. That's a brand name, Prestige. Desvenlafaxine. How do you stop Prestige with the severe side effects? So it sounds like you're having such severe side effects that might not be the right medication for you, and you might consider, if you've been on it for a while and the side effects aren't getting better, if you're not tolerating them, talk to your doctor about changing to a different medication. I'm eating a salad. It's a chicken, egg, bacon, I think goat cheese salad. It's okay. Fibromyalgia can be diagnosed by a few different doctors. A chronic pain physician, like an anesthesiologist, can do it. Sometimes a neurologist. Sometimes your primary care. But the thing is, you might have to see many different doctors to rule out lots of different things. I'm having those from trying to come off Prestige. Oh, if those are the side effects you're getting from coming off Prestige, that's not surprising. That can absolutely happen. So you have to taper it slowly. And that's what I was saying is talk to your physician and develop a tapering plan if you want to come off one of those medications. Hey, thanks for liking, following. Go check out some of my new videos. I appreciate it. It helps the algorithm. Tapping the screen and pressing the like button helps too. Is fibromyalgia genetic? I don't know that answer. I don't know if there's any good research if anyone actually knows that answer. I wouldn't be surprised if it was. I believe doctors should warn patients about how addictive Lyrica is to your brain. You don't notice. Yeah, Cindy, that is true. And that's also true for many medications. They can kind of become physiologically dependent in a way. How about lupus related to the mind and mental anxiety? I would say that everything is related to the mind and mental anxiety and stress, right? Because mental anxiety and stress and pain can manifest in physical ailments and can increase cortisol levels, which reduces, your immune system, which, then you're more susceptible to things like the flu or a cold, right? So it impacts everything. Your pre-weekend and post-weekend video scared me. Yeah, it is a little scary, and I hope it's not true. I hope maybe there was some what we call research bias in there, and maybe all the surgeries on Fridays are more likely to be sicker or something, and that's why they found those issues. But I don't know. The research is what the research is. Janie said she had a perforated bowel surgery a year ago. It was an emergency. Still having pain, and no docs can figure out why. After you have surgery, you can absolutely have crazy, weird pains all the time. Um, it could be some nerve injuries. It can also be PTSD from such a traumatic event manifesting as real pain once again. Because my bilateral trigger finger release was done on a Friday. That's a pretty standard, pretty safe surgery. And so you're probably unlikely to have any major issues from really small, simple, standard surgeries like an appendectomy or something like that. Going for a DNA test to find out that you're 100% awesome. Oh, sorry, I misread that. To find out what meds are good for severe anxiety. What's your opinion on that? That's called pharmacogenetic therapy. It's very new. I've never done it. I've never ordered it for my patients. My wife's a pharmacist, though, and she uses it a little bit. So, yeah, I think that could be effective in finding you a medication that works faster. Yeah, I think that could be good. I was diagnosed with type 1 diabetes after taking the Mounjaro shot. I highly doubt, actually, I'm pretty sure that the label or the known side effects of Mounjaro does not include type 1 diabetes. Type 1 diabetes is almost always a genetic thing, something that you're born with, where your pancreas just isn't working right. I mean, you already know this because you have type 1 diabetes, but for those that don't. But I don't know. Oh, autoimmune, yeah. So an autoimmune, so your body is attacking your pancreas and making your pancreas not develop insulin. Probably a coincidence more than a cause from the Mounjaro. I think Klonopin is a generally safe and effective medication. It doesn't have a lot of, I mean, it's a controlled substance. If you need it, take it acutely, but it goes back with the other ones like Xanax and Ativan. Don't take it long term. Try the other ones as well. But if you need it, just like the Xanax or something, like you need it. 34 is a very rare and unusual age to develop type 1 diabetes. That is true. It is very rare. Restless legs, usually iron supplements. A drug called ropinirole can help with restless leg syndrome. And then, yeah, that's pretty much it. Physical therapy might. I was diagnosed with Hashimoto's. Does anyone else have Hashimoto's? About 10 years ago. Never had stable results, my last one being the highest. So Hashimoto's, someone said magnesium for the RLS. There you go. And I think magnesium helps in the same vein that iron would help. Hashimoto's is essentially where your body's attacking your thyroid. Kind of like Christy XX's body is attacking her pancreas and causing diabetes. You can get Hashimoto's, your body attacks your thyroid. You don't produce thyroid hormone. And you have to, at that point, there's no cure for it, unfortunately. So you usually have to take lifelong thyroid supplements. Silent Watcher Rana, I wish I knew what the exact cause of restless leg syndrome was. But the fact that ropinirole helps tells me that it might be some sort of issue with dopamine in your body. But also iron and magnesium kind of help, right? So I don't know. It's kind of weird. 34 with a bowel perforation. That's very rare. Why? You were so young. How did your bowels perforate? Hey, thanks, Teresa. Thanks for the fireworks. What causes hand tremors? Sometimes hand tremors can be caused by neurocognitive dysfunction, diseases like Parkinson's disease, dementia, etc. Sometimes you can have like essential tremors or benign tremors that are just kind of a genetic kind of condition. Hey, thanks, Cindy. Thanks for the kind words. It's crazy. Just to have a random hole in your intestines is pretty rare. Look at you drinking tea. You need a Texas home AT. Absolutely. I'm definitely like a Southern guy at heart. I love my barbecue. I love mac and cheese. I love sweet tea. I love all these things. What's up, guys? Welcome. How common is it to receive Norcan? Maybe you meant to say Narcan shot upon waking up from surgery, removal of adrenal and tumor. So I'm recently learning that several anesthesiologists oftentimes use Narcan or naloxone in their practice on a pretty common basis. Um, I have only used it one time ever, and it was because we absolutely needed to. Um, well, as far as surgery, I've used it other times in other scenarios, like in the emergency room or in the ICU or etc. Um, but no, it's not in general a very common practice amongst anesthesiologists. I think if he's still in here, there's another anesthesiologist that I saw join, Doctor. I think it was is it Doctor? Yeah, Ryan Jameson. I'm wondering if you use or how often you find yourself using Narcan or naloxone. I did not always know I wanted to become a doctor. If you want to go to my profile, I have like a little story about my journey to becoming a physician. In short, grew up poor, foster care, parents with drug addictions, abuse, etc. And then joined the military at 17. I was in the military for 8 years. Um, I was in the bomb squad, loved that. And then was a volunteer firefighter and EMT, kind of loved the EMT side of things. Had my degree in electrical engineering. I decided to go to medical school to kind of create, you know, to for one, be a doctor and take patients, right? But also to develop and help with medical innovation and such. It was a good time. Have you worked other specialties? I started off in surgery and switched to anesthesia pretty after my first year of surgery. I'm very happy about that switch. They give Narcan always in Texas if you are prescribed painkillers for safety. I don't know about that practice in Texas. I thought I had Parkinson's, but thankfully it's innocent benign. Good, Debbie, good. You don't want Parkinson's. Is it common to have tremors after having a panic attack? Yeah, actually, panic attacks are often associated with tremors. I use Narcan probably less than a handful of times a year. Yeah, so Ryan, Dr. Jameson, I'm seeing that sometimes anesthesiologists, so I've heard, are giving patients that are chronic opioid users Narcan, or it might be their surgeons actually, but I'm just seeing it being given in the preoperative setting as a way to like desensitize them to the opioids or something, so that I don't really know really why they're using it. I haven't read any papers or data on it, but I have panic attacks. I maybe I should do a video on anxiety and panic attacks. It is definitely a common issue amongst individuals. Pain management gives it here in Texas. Pain management giving Narcan. It's weird. Can have non-stimulant for ADHD become addictive? I think kind of. Yeah, I agree. It is not part of my practice to give Narcan on a regular basis. We only usually give it, of course, I'm sure just like Dr. Jameson does, whenever someone's having like a delayed wake up from anesthesia, or maybe they're in the recovery area and not breathing very well. Can a stimulant for ADHD become non-addictive? Traditionally, the non-stimulant medications for ADHD definitely have a lower addiction potential, but sometimes, I mean, even things like gabapentin, pregabalin, Lyrica, even the devil's lettuce, lots of medications can kind of become, your body can kind of become physiologically dependent on it, or you can even get a psychological dependence on it. You take it all the time, etc. I have lower spine fusion and severe DDD. My left hip itches. Itches. So again, I can't give you medical advice or diagnose you. I can't tell you why your left hip. Hey, thanks so much for the likes. That's so sweet of you. While you're having these problems, but if someone came to me, they had a lower spine fusion, DDD, with a left hip that was itching. That is, I mean, that could be a sign of a nerve injury. But that's, I don't know. That's beyond my scope. I just don't know. I'm sorry. You can get addicted to Lyrica. It's. I've had people tell me that they've found themselves having a physiological dependence on Lyrica. Yeah, and gabapentin. Big Mama says she had a similar problem. Yes, my neurologist gave it to me for narcotics pain medication I'm in California. What causes a urinary tract infection? Urinary tract infections, or UTIs, are pretty common. I'm not an orthopedic surgeon. I'm not a surgeon at all. I'm not even a board-certified anesthesiologist. I'm a third-year anesthesiology resident. I do have a medical license to practice medicine independently, but I am in my residency. Just so we're clear about my credentials, I'm not trying to be someone. I'm not. Someone asked, oh yeah, so a UTI, or a urinary tract infection, one of the most common things that people see in the ER and urgent cares, etc. Signs and symptoms would include increased urination, so peeing more frequently, burning and pain when you pee is very common, itchiness down there, and those are the most common ones. You can also have discharge. What causes it is bacteria, so not being very hygienic. Coitus, that's the medical word for you know what. All those things can lead to having UTIs. Hey, thanks so much, Lindsay, for the kind words. I appreciate that. If you are older, UTI are very serious. Do not take them lightly. They become very angry. I agree. Even if you're younger, right? If you don't treat a UTI, that infection can actually climb up to your kidneys and cause some very serious problems. So let's see. Fever and confusion big with UTI. Absolutely, yeah. You can get fevers. If you're getting fevers with a UTI, man, you need to go in. You need to see a doctor right away. I mean, if you're having UTI symptoms, you need to go in, period. But if you're having fevers, that might not just be a UTI anymore. It might have gone up and become what's called pyelonephritis. Nian Kamala said, do you suggest any therapy, doctor? I don't know what exactly you mean. I see a therapist. So I, in general, recommend therapists. Thank you for the kind words, Diane. I appreciate it. I'm down in Southern California, living the sunny life, the warm weather. That would definitely be sepsis at that point, a UTI. It absolutely could be. UTIs, if untreated, can spread and become systemic, right? So take care of yourself. I think, unlike my peers, Stanford's in, I think, Northern California. I think Stanford is in Northern California. I would still study medicine. I would still choose the path I took. I would still choose it in the exact order I took, serving in the military, enlisted for a while. I would still study even electrical engineering and then go into medicine. I love the things I learned. I love the things I did. And I think, my past and history is obviously what shaped me and made me become who I am today. And I'm, in general, happy with where I'm at and what I'm doing. Anesthesiology residency. That's what I do, World Steward. It's hot in Texas. Absolutely. It is hot. That's why I like Southern California. It gets warm out here, but not too hot. The fires, there are no current fires going on that I'm aware of in LA or San Diego. Sparkles said she's having cognitive issues after anesthesia. Is she allergic to anesthesia? Not allergic, no. Cognitive dysfunction, things like brain fog, memory problems, confusion, can be common after surgery. The older we are and the more issues we had at baseline with our memory, maybe we had an underlying dementia or something like that, the higher the risk for that cognitive dysfunction. The risk really increases once you get over the age of 65. The brain fog and the neurocognitive dysfunction usually resolves pretty quickly, but it can last. My CAT scan showed I have pancreatitis, but MRI said pancreas was unremarkable. But I have a pain in the middle of my stomach. Doctor says I'm okay. Should I go elsewhere? I can't give you medical advice or diagnose you, Philip Winston. But I can say that if you're still having signs and symptoms, you're still having severe pain, yes, you should continue to seek medical care and go elsewhere. Um, can't tell you what's going on, but it seems like you have something going on. Melatonin can make you have nightmares. That's fascinating. I've never had many people say that. I'm scared to get an endoscopy. Any advice? Let your anesthesiologist know that you're scared. Let your surgeon know that you're scared, and they might be able to give you some relaxing medications. In general, though, endoscopies are very safe. The anesthesia form is pretty straightforward. Um, and your anesthesiologist, I would recommend requesting an anesthesiologist instead of, say, a CRNA. I mean, we just have a higher level of training and skill. That's not to say my CRNA peers aren't also excellent. So if you have a CRNA, don't be scared, especially for an endoscopy. They're very straightforward. Could expressive dysphagia be the beginning of dementia or Alzheimer's? Yeah, very well could be. More often, if you're having what's called expressive dysphagia, I'll break these words out for you. Dysphagia is like an inability to speak, and expressive, you can't communicate your words. That's what that means, right? So that frequently is associated with having a stroke. If you or a loved one are having issues talking, slurring your words, or you're thinking of words in your head, but when you speak, it's a different word, you need to go to the emergency room. Diane Rogers, I'm confused. Are you saying the older you are, the higher you're probably, are you saying? I don't understand that. I'm sorry. That sounds even scarier to get calming medications because medications make me nervous. No, this medication, Versed or Midazolam, make you feel like you've been at happy hour for a while. Make you feel very good. You'll like it. Trust me. Endoscopies are okay. I had an upper and downer at the same time when I was 45. Yeah, it's very common to do that. Do not play with your pancreas. I agree. There is a few rules of general surgery. Eat when you can, sleep when you can, and don't touch the pancreas. Those are the rules of general surgery. I'm having numbness and burning feelings on my left upper leg. What do you think it is? Rachel, I can't diagnose you. I can't do a physical exam on you. I can't see your medical history, your medical chart, and I can't practice medicine across state lines or via TikTok. But if someone came to me and they said, Doc, I'm having numbness and burning on my left upper leg, I mean, that's a description of what we call neuropathy, right? It sounds like clear and obvious nerve pain, nerve issue. And you have different nerves up there in your left upper thigh. Could be, hang on one second. There's a term for this, and neuralgia paresthetica, which is a condition where your left upper nerve has those symptoms, or lateral cutaneous nerve neuropathy. And it can often be found when you've had increased weight gain, wearing tight pants. It's seen in pregnancy. It's seen if you've been positioned in a certain way for a long period of time. I'm asking if your risk increases with age. Yes, in general, your risk of anything and everything, no matter what we're talking about, increases with age. Leilani, it is bad to remove 3/4 of your pancreas, no matter under any conditions. That is not a good thing. What's up, Steven? Steven Shelton? What kind of doctor are you? Weight gain has so much on your health. It does. Mm-hmm. Sparkles, that is true. It is a rare but possible consequence. Chipping a tooth or knocking a tooth loose when undergoing anesthesia for the breathing tube. I've never had it happen to me. I don't plan on starting it today. You can slow down degenerative disc disease by strengthening your core, your back, taking care of yourself, and avoiding the activities that were causing it. Wow, that's pretty rare, Leilani. I do have lymphedema as well, neuropathy as well. Yep. I've been on scopolamine patches for a few years for motion sickness every day. Every 3 days, I had to change it. Wow, Mallory. So scopolamine patches work very well. I don't think I've met someone that's been on scopolamine patches chronically. That's a first for me, guys. Very first. By the way, guys, if you have some personal questions, some things you want to talk about, if I'm not answering your question just because of the chat so much, feel free to subscribe. Oftentimes when the chat gets 100 to 300 people and the questions are going, I'll shut it down to subscribers only. Then we can have a more personal chat. And then also, I have so many DMs. I probably have over 100 unread messages, and I cannot read them all. And I will not read them all just because I have 2 kids, a wife, a dog, a career, that I can't put all of my time on social media. But if you're a subscriber, I will prioritize your messages and try to look at them and see what's up. Nurse practitioner. Have you guys been treated or seen a nurse practitioner? I'm curious, what are the chats? What are your guys' thoughts on nurse practitioners, NPs, and what are your thoughts on physician's assistants? Do you have a different opinion of a nurse practitioner versus a physician assistant? I'm really curious to see what you guys think. I work with both every day, all day. I'm just curious. Nurse practitioner is your primary care provider. My sister is a nurse practitioner. So a nurse practitioner is your general medical provider. So in general, they are not the same thing. They have 2 different pathways and 2 different certification processes. I'll start with nurse practitioners, probably the thing that people I think are familiar with most often. It's someone who went to got their 4-year bachelor's of nursing, BSN, was a registered nurse, and it used to be that you had to work as a nurse for a certain period of time before you could go to nurse practitioner school. But there's been an explosion of nurse practitioner schools opening up and stuff, and frequently they're waiving that requirement and not requiring. I know actually a large portion of the new nurse practitioners that I've worked with and know never worked as a nurse at all, which, 10 years ago, I don't think that was true at all. I don't think that would have ever happened, but it is now, for what it's worth. So they get their 4-year degree, and then they go to anywhere from like a 2.5 to a 4-year program for nurse practitioner school. Most of the nurse practitioner schools now are actually online for your first 18 months. Your didactics or your lecture portion is almost all online, and then there are some well-established, good name brand schools. Think all the Ivy League schools that have nurse practitioner programs are great, and then there are a bunch of these new nurse practitioner programs that are opening up, and a lot of the new NP schools don't have agreements with hospitals and stuff. So nurse practitioners are having to coordinate and set up their own clinical rotations. So what does that mean? That means a nurse practitioner has to call a hospital or a doctor's office and say, hey, I'm supposed to do a pediatric rotation. Will you be my pediatric preceptor? And then what happens there is they show up and they kind of learn the pediatric portion of clinicals. And the problem with setting up your own clinical rotations versus going to a nurse practitioner program that has an established hospital or something is there's just a lot of variability in the quality of the education that you may receive on that clinical rotation. So, and then oftentimes, some of the nurse practitioners, they're telling me they have to pay for that, right? They have to pay additional money to their preceptor to take them and teach them for that rotation. But that's the pathway to becoming a nurse practitioner. Then becoming a PA is a little bit different. PAs, generally you have to have a 4-year degree. And then you also have to have some experience with direct patient care, if that's being an EMT, a paramedic, a CNA, an LPN, or something. Most all of the PA programs require some level of clinical hours, and the exact amount of hours varies depending on the program. But I think that's a pretty universal requirement. The prerequisites I found, because I was considering going the PA route instead of the MD route, I found that is actually generally much stricter for PA because the schooling is much shorter than medical school. And so essentially they kind of have to make sure that you're prepared going in because they don't have time to teach you basic, some of the basic concepts. And then it's usually a 2-year master's program to become a PA. Like 1 year of didactics, 1 year of clinicals, and then you're a physician's assistant. I've had great experiences with both. Is it true that to be a PA, you do need med school, and as an MP, you don't? No, PAs don't go to medical school. If you went to medical school, you're a medical doctor. What's your most memorable pediatric patient? My most memorable pediatric patient is frankly very traumatic. And it was the day that I realized I would never do peds because I could not emotionally handle it. I was on my pediatric ICU rotation, and this 32-day-old baby, this mother and her 32-day-old baby were involved in like a minor traffic incident. They were like, rear-ended. So she pulled over on the side of the road. She got out of the car, and then she went to go check on her baby, and she unbuckled her baby. And moments after she unbuckled her baby, her vehicle was struck by a semi-truck, and it ejected the child very far. And the baby was admitted to the ICU. And then the mother was also admitted to the same floor. She didn't have major injuries at all. She was fine, but they admitted her on the same floor so that she could be really close to her child. And for days, because my little workstation was right next to her room, I just heard sobbing and sobbing for hours. And it was so terrible. It was just such a terrible, sad situation. It broke my heart. And I'm like, I can't do this. I can't do this. Like most of the pediatric cases and patients like are fine, and everything goes well. But like when it doesn't go well, it doesn't go well. And I can't emotionally take that, right? And in a sadder sense, and maybe it's, I don't know, but I can more emotionally deal with like an adult having a really bad outcome. But when kids do, it just breaks my heart. I actually don't know what ended up happening to the child. I know they were in the ICU for at least a month because that's how long I was, I think, on that rotation. But Aiden, you can't be an MP in the ER and in the ICU. I would recommend picking one or the other. Those are kind of two different specialties entirely. And I'd rather be really good at one thing than kind of good at two things. Yeah, it is so sad. And that's why I can't do peds. I love it. I love that people can, but it's not for me. So how would an MP to PA just another service? No, you have to. So again, the MP and the PA, two totally separate programs. So if you have your nurse practitioner license or whatever, you have to then apply to the PA school and get in for 2 years. I'm a sophomore nursing student in nursing school thinking about med school. I highly recommend it. Some of my peers that were nurses before they went to medical school are the best physicians I know. Aaron Lee, that's another point. When you're dealing with peds, you're also dealing with the parents. And sometimes, like in one of the videos I posted recently, parents aren't well educated and they make really bad decisions for their kids, and there's nothing you can do about it. Aiden, go to medical school. You'll love it. Thank you, Kitty Cat. I appreciate it. All right, guys. I think I'm going to call it an evening. I'm going to finish getting ready for work. start my night shift. Thanks so much for coming on. Join my team, like and follow the page. If you go to my page, if you want to get notifications or alerts when I go live, you can click on my page, and then there's a little bell icon in the top, and you can click that, and that icon will let you know. To learn a little more about my journey, I posted some videos. I think they're pinned at the top of my page. Feel free to check it out. But thanks so much, guys. Thanks for coming out. And remember, be kind, because you never know what kind of battles the person you're talking to is having right now. Have a good one.